So maybe you've been diagnosed with gout and you might be wondering, what is it? How do you treat it? And how do you prevent those horrible gout attacks from flaring up again? In today's video, I'm going to cover all of that, so stay tuned. Hi, and welcome back. I'm Rosen. Thanks for tuning in. If you have not already, please subscribe and click the thumbs up button so people like you can find information like this. And if you're struggling or dealing with knee pain, maybe considering knee replacement, be sure to check out my book, The Knee Book, which you can find on Amazon. In it, I give 20 years worth of my experience as an orthopedic surgeon on what I teach and explain to my patients about how to get the best out of their knee if they go through a knee replacement. In today's video, though, I'm going to take a little spin away from the surgical aspect and talk about something that some people do deal with, and it can be extremely disabling and painful, and that's gout. Many people are diagnosed with gout and may not know actually what it is or how to best treat it, so I'm going to cover all of that and more in today's video. Now, what is gout? So gout is a crystal buildup in the joint, and if you see this under a microscope, it looks like these sharp little needle crystals that can form inside the joint and cause significant or severe pain. It's similar but different to another thing that can cause joint pain called pseudogout. And pseudogout, or calcium pyrophosphate deposition, is a buildup of a crystal, but a different crystal, and usually the pain and symptoms are not anywhere near as severe as a true gout attack. Now, gout attack classically occurs in the big toe, but it can occur in the knee or basically any other joint within the body. And it can even occur in a knee that has been replaced. So even though you may not have cartilage or a meniscus with your knee replacement, your body still produces fluid, and you can have a buildup of these crystals in the replaced knee. Now, the symptoms usually are severe pain, swelling, redness, decreased range of motion. And occasionally we have to do things to rule out an infection, but those can be the classic signs and symptoms of somebody that's having a gout attack. Now you might be wondering, okay, well, why will I get a gout attack? Well, this is due to a buildup of uric acid in the blood, which then precipitates in the joint, and these crystals then cause the symptoms. Usually it's due to one or two things, and it can be either or both, but it's either an overproduction of uric acid or an under-excretion of uric acid by your kidneys. Now, there are foods that are known to cause gout attacks or can increase your risk of a gout attack. So these are things like red meat, organ meats, things like liver or pancreas that some people eat, alcohol, especially beer, and sweetened drinks. Those foods are the foods that can cause an outbreak of this uric acid crystals and a gout attack. Now, we also see this with people that are overweight. We see it more commonly in males than females, and certain medications might cause gout attacks. Now, you might be wondering, okay, well, how do we diagnose it? Like, how do we rule out the difference between pseudogout and gout or an infection? Now, the first thing that many doctors do is a blood test, and a blood test looking for the uric acid in your blood. But that does not diagnose a gout attack. You can have high uric acid and not have an active gout attack. It just means that you have high uric acid and you might be at risk of a gout attack. And also, we will see people that are having a gout attack, and the blood test shows that their uric acid level is normal. So a uric acid level by itself does not diagnose a gout attack. The only way to truly diagnose a gout attack is to stick a needle in the joint and aspirate the joint and send that fluid off, or look at it yourself underneath a microscope for these crystals that we can see. Now, we also typically get x-rays, and x-rays are there to diagnose other things like a fracture or arthritis that might be similar to a gout attack, but maybe you don't have a gout attack. Maybe you just broke the bone in the joint, stubbed your toe on the bed when you were going to the bathroom in the middle of the night, and now you have a red, hot, swollen, painful toe. But some people can have arthritis and a gout attack at the same time. Now, treatment, we break it into treating the acute flare-up and how do you prevent further or future flare-ups in the future. So the treatment for the acute gout attack, one option is steroids. We can either give oral steroids, things like prednisone, or we can inject steroids like cortisone into the joint, especially like the knee joint. We can inject cortisone into the knee, which can reduce the symptoms of the gout attack and cause it to go away. We might also use just regular oral anti-inflammatories or NSAIDs. One of the most common drugs used for this is what's called Indocin or indomethacin. The other option is a medicine called colchicine. So this is a medicine that you will take, and it can really decrease the symptoms of a gout attack. One of the most common side effects, however, with colchicine is diarrhea. Now, for patients that have chronic gout attacks, so frequent gout attacks, they may also have blood levels that show a constant high uric acid level. We can use medications like allopurinol or a newer medicine called Uloric, which lowers the uric acid in your blood, which might decrease the chance of a future gout attack. The other important thing is what's called a low purine diet. So we've talked about the foods that are bad for patients that are predisposed to gout attacks, but there are foods that you should consider incorporating into your diet to prevent future gout attacks. These are low purine foods, so things like vegetables, which are good and healthy. Things like grains, not oats, but other whole grains can be helpful. Most fruits, especially cherries, have been sort of talked about very commonly, and fruits that are high in vitamin C, and other things like just simple water, staying hydrated. Some studies have shown that patients that drink skim milk may help reduce the risk of a further gout attack, and also things like coffee can help. So this information is just there for you if you or someone you care about has been maybe diagnosed with a gout attack and you're trying to learn out more about it, or maybe you yourself have a gout attack and you're not really sure how to go about in the future preventing future gout attacks. The most important thing being change your diet. A lot of my guys that enjoy a steak and a beer don't necessarily like the rules, but at least they know that if they do that and sort of cheat on their diet, they might be more at risk of a gout attack. And this is when, if they're on vacation, they might keep the medication handy for an outbreak. But if you're having multiple gout attacks, you may talk to your primary care doctor or orthopedic surgeon or rheumatologist to see if your blood is showing a high uric acid level, and then you might be a patient that would be best served by one of these meds for chronic control, which may decrease the chance of a future outbreak. So until next time, thanks again for watching. I'm Adam Rosen. Stay safe.